how many times does a GP take out a tooth and a patient is missing a tooth, and literally the next step is tooth replacement options to discuss.
Yeah.
And so it naturally will have a snowball effect, but initially it is quite daunting because you're worried, I'm going to spend all this CPD and time and equipment and buying all this. Am I ever going to do a case?
That was Dr. Leighton Phu, and this is Dr. Omid Azami, and this is the Noobie Dentist Podcast. Welcome to the Implant Mini Audio Residency. This is a project that I've been working on for a long time, and I'm really excited to share it with you, the listeners. The Mini Implant Audio Residency is a 5-part series, starting off with the basics of implant dentistry and going through the different steps of planning, the surgery, the restoration, integration, preparing your team, marketing. All the factors involved in implant dentistry will be covered in this mini implant audio residency. Over the next 5 episodes, I will be speaking with general dentists, with prosthodontists, with oral and maxillofacial surgeons, as well as experienced implant dentists who share their stories, their knowledge, their expertise, and we talk about the different aspects of implant dentistry involved. I'm really excited. This is a project that I've been meaning to do and publish for a long time. And now that it's here, now that it's ready, I'm really, really excited to get this out into the hands, into the ears of the listeners. And we will have some great fun over the next 5 episodes. This week's episode 1 of the Mini Implant Audio Residency, is with Dr. Leighton Phu. Dr. Leighton is an amazing dentist here in Melbourne, Australia, a practice owner and a dentist heavily involved in implant dentistry. In this episode, we talk about his journey from graduation into implant dentistry, the trials, the tribulations, the wins, the losses, and really the pathway that led him down to where he is today with implants, and his comfort level in providing top-level implant dentistry solutions for his patients. So I hope you guys enjoy this episode, and I hope that you get a lot of value out of it. I will include Leighton's contact details in the show notes below, so if you have any questions for him as a follow-up, you can always reach out to him. This week's episode of the Mini Implant Audio Residency is brought to you by my good friends at Mordent. Mordent is your proudly Australian-owned and operated partner, driving the charge forward in integrated digital dentistry. Being the only fully integrated local dental company, Mordent offers world-class education, equipment, products, solution, and support. The Mordent team of over 50 specialists are helping thousands of Australian practices to seize the opportunities in digital dentistry, transforming treatment for their dentists and the patients alike. Whether you're seeking to upskill through education or are considering implementation of digital dentistry into your practice, or just looking for some advice, I highly recommend reaching out to the Mordent team. Visit www.mordent.com.au to find out more. I will include their information in the show notes for those interested. As always, if you're new to the Noobie Dentist Podcast, thank you for checking us out. Be sure to head back and check out the previous episodes that I've done on the podcast. I've had the privilege of having some amazing guests on the podcast over the past couple of years. If you're returning, thank you for your ongoing support of the Noobie Dentist Podcast. I hope this mini implant audio residency is full of value for you. And if you are getting value, please head over to iTunes and give the show a 5-star rating. These ratings help the show get more traction within the dental community. Without further delay, enjoy this week's episode. So I'm joined today by Dr. Leighton Phu, who has kindly agreed to come on and talk about implant dentistry for the general dentist. This is episode 1 of the Implant Mini Residency. And Leighton, I'm really excited to kind of get your perspective. Over the next few episodes, I'll be talking to different specialists and how the surgical aspect of implant dentistry, the restorative side of implant dentistry. But I think to start us off, as a general dentist doing some really nice work within implant dentistry, your journey, your story, and everything will be really exciting. So first of all, thanks for coming on. And second of all, if you can just kind of tell us about yourself a little bit, and then we'll kind of jump into it.
Yeah, my pleasure. Happy to share and happy to be on as well. Thanks for the invitation. And I really enjoyed interviewing you a few months ago in the Dental X vidcast as well. So it's good to get the tables turned around.
Yeah.
And I guess I've been asked to share about my experience about implant dentistry and how I started from a new grad, and I guess to where I am now and where I headed and want to be. So I guess just a bit about myself. I graduated from Melbourne University in 2011,
Yeah.
And for the first 3 years, I moved out to rural Victoria, Wangaratta, to work. So really busy, 5-chair practice, heaps of mentorship, lovely patients, super chill, and really was able to hone my skills in GP from a broad range of pros, dentures, extractions, of course, restorative. So it was good to dabble in, I guess, try a bit of everything. And I quickly learned what I did like, what I didn't like.
Yeah.
But there was zero scope for implant work. The principal, Dr. Tony Goodison, who was amazing, he did some implant work, but other than that, there wasn't really any scope for us associates to do so. And I was, too busy doing, working on all the basic stuff as well. And I actually wanted to be an orthodontist.
Really?
When I finished uni. Yeah, that's why I got into dentistry. So it was a great experience I had with my orthodontist. And it was only when I guess, moved back to Melbourne, with family situations, and my now wife, started a new job in Melbourne as well. It was time for me to go back. So 2015, I started working in CBD Melbourne, and I joined a practice with Harry Schlen, where I currently still am now. And obviously that Harry's very experienced in implants and teaches at the Dental Implantology Academy. And he said, "Leighton, don't worry about ortho. You're going to love implants by the time I'm done with you."
Yeah.
And which is ironic because I kind of do everything but ortho now. And you're really geared towards implant dentistry now. Probably a majority of the work that I do at the practice. And I haven't looked back since.
That's awesome. And I think, it's good to get that overview of what sort of you've been through now, but I guess I'm curious is like the nitty gritty of it. Because I think a lot of people listening either are wanting to get into implants or are maybe enrolled in or taking courses and things at the moment to get into to do implant dentistry. But I think that actionable step of, like going from not placing to placing, there's sort of like a lot of barriers along that path. Is it equipment? Is it imaging? Is it just like clinical skill and knowledge and things? So tell me for the learning curve from when you started this practice with Dr. Harry Schlen, who we'll have on as well later, to placing your first implant, sort of what happened in that time period?
Yeah, I was very grateful for my journey, I guess, because I felt like I was really well supported and mentored and had the opportunities to be able to get my feet wet. When I first moved back to Melbourne from Wangaratta, having full books, to Melbourne and literally starting with zero, so I was just sitting around not doing much. And rather than, feeling sorry for myself, I just had to find ways to make the most of that. So whether it be, really improving myself with CPD, but just the downtime at the practice was just spent, assisting and shadowing all the other dentists, especially Harry. And really fortunate because across the corridor, Professor Gruber, who was my OMFS professor at uni, his private practice was there as well. So he was really generous with his time and allowed me to assist in watching his surgeries anytime. So a lot of the learning from osmosis initially, just by getting a feel of it. The most daunting thing I think with implant dentistry, first starting off, is the amount of componentry involved. And I guess the different implant and implant lines, even just within one particular brand or system, let alone, all the hundreds of them out there as well. So just really familiarizing myself with the workflow, what tools do what, which components do what. And then eventually that evolved into me, assisting chairside. And then the next natural step was, for me to be in the driver's seat with Harry at the time assisting me, and I guess, working together that way. So I think I was very fortunate to have that support, but also equally as important to have, I guess, the patients were kind enough to let me, work on them as well. And a lot of these patients are ongoing patients who've, been at a practice for a long time and kind of trusted us. And just taking it step by step, really, which is really important, because I'm not really a gung-ho type of dentist. I really, because I know what can go wrong, and I'm very aware of that as well. So I always want to take one step at a time rather than jumping right in the deep end. So I think that really worked well for me, taking it step by step. And it just evolved from a single implant to, multiples, to understanding definitely the restorative components of it as well. leading to full arch and soft tissue work and everything in between as well. So just step by step. And the more you I guess the more you get deeper into it, the more you realize you don't know, and it just forces and drives you to learn more and improve. Yeah, you don't know what you don't know.
Definitely. I think that's amazing, because a lot of people have interviewed, just not for implant dentistry, but just across the board, of like, especially like young dentists are doing really well. That theme seems to be quite common in them, that they've started off at a practice that had good mentorship, but they weren't necessarily busy. But like you said, instead of feeling sorry for themselves, they really were proactive at that time and actually, chasing up CPD, assisting, and trying to get as much exposure as they can, and not just, staying at home if they don't have like any patients booked for that day type thing. So I think that's like one amazing sort of commonality that I've seen across a lot of different sort of successful dentists. So I think that's great. Within the implant piece, while you're observing and everything, were you doing any sort of like formal education or any CPD or anything to go along with it? Or you're just kind of like learning on the job essentially?
Yeah, definitely. I mean, in addition to, and that's just one aspect of what happens in the clinical rooms, but a big part is, I was looking, and I'm sure many new grads do, looking at all the implant courses and then which one to do. And naturally, you think if you have zero hands-on experience, I wanted to do the idea of flying overseas and I guess getting, hands-on experience placing 20 implants in. That was appealing, but I thought, number one, I didn't have any money. And number two, I thought, just given where I was, it would be good to just understand the basics first and get some context before you really get into it, because there's no point placing in 20 implants and by the end of it, you don't really know what you've done or completely understand it. So in the meantime, whilst working in the practice, I attended as many courses as I can, and some of the great ones, obviously, working in Harry's practice as well. I came along to all the MIS Mordent courses, the hands-on and lectures on the weekends, and really finished all their programs as well, and that really helped solidify my understanding of the implant line, componentry, and really worked in tandem together. And I guess after a couple of years of doing that, naturally you keep wanting to expand and learn more. And so I've just done a ton of courses locally, interstate, internationally as well, just trying to learn from the best around the world and just keep building on the skill set. But I think the initial foundation, by I guess just being really familiar with a particular system that's already in your practice, because there's no point, if you're an associate and your principal's already, I guess, well geared and well equipped for a certain implant system, there's no point introducing another one. They're probably not going to want to outlay the capital for that initially. But also just makes sense to, I guess, stick with the same system that your mentor or your supervisor is going to be familiar with as well. And I'm just really glad and happy that the system that I grew up with, which is MIS, really well developed system, really popular around the world as well, especially in Europe and America, and as well as Australia. And just learning from other different companies and different philosophies. So far, MIS has really all the componentry and all the systems in place that's necessary for what we do. Yeah,
that's excellent. So in terms of picking out courses, you mentioned the different types of them, those overseas ones where you go and just kind of get your hands wet, get repetition, but necessarily the didactics may not be there in terms of the base knowledge. If you have someone coming to you asking for advice that they want to get into it or want to make a big investment, like is it going to be like a modular based, like large course, or just doing small courses here and there? What would sort of be your advice in terms of CPD around implants?
Yeah, I think it doesn't, again, this may or may not be the right way, but I was thinking baby steps is doing it well. You're never going to learn everything from a weekend course, but it's definitely a good starting point, and so I think what was helpful for me was just starting with an implant system that I guess you have access to, and I guess learning everything you can from them, whether it be local courses. I've been very lucky to have a lot of specialist colleagues who've been very supportive and really generous with their time as well. So not only learning from them, but even working with cases together. So initially, if you want to get into implant work and you're not resourced or don't have the confidence to place the implant, work with a surgeon to be able to place the implant first, and then start with the restorative first, and then build it up from there, and then learn from each other. And in my experience, especially with MIS Mordent as well, a really extensive network of experienced and knowledgeable and generous specialists to help you along. I'm sure there's a few excellent ones coming along in this series as well.
Yeah.
So I think taking baby steps, and then eventually when you do feel ready, and I guess to expand your horizons, look further and develop from there. So that's what I did with my, I did the guide program, which I really enjoyed,
nice.
which is run based in LA. But modules, they have modules all around the world as well. So I mainly did in Sydney, Vietnam, and UCLA. So Loma Linda in California. So that's back in the days when we could travel.
Yeah, no, that's a really good comprehensive program. So I think that's definitely a decent one to look into. In terms of roadblocks and obstacles for getting started in implants, with like CBCT now, like being so heavily relied upon, and all the different componentry and things that you mentioned. If you are an associate who works at a practice and the principal doesn't do it, or even if you're a practice owner who wants to get into it, what are like some of like the absolute musts that I think you think that we need to have in the practice before you kind of start?
So we're talking about surgical placement, Amit?
Yeah, surgical placement. Yeah.
Yeah, obviously the biggest outlay, or for me, because I actually started also working as associate at another practice with Andrew Cheer. And I, so the biggest outlay was initially just getting the implant motor and the hand pieces as well as investing in the actual implant componentry itself. But the great thing that I found was with Kane helped me out a lot setting up as well, is that you don't have to buy everything all at once. You can pretty much order the surgical guides or the implants components on a case basis. So the outlay isn't significant. And, the implant motor, it's something like you keep it forever as well, So that was pretty much it. Everything else, per case, it depends. If you don't want to overcapitalize and overstock on certain things, you can just order it by consignment. Which makes it, quite reasonable to spread out the cost that way. But obviously, having not only the equipment but the support of either a clinical mentor, or even if you're starting with baby steps. I know Kane was more than happy to come out with me for my first few cases to really, hold my hand essentially and just show me what's what, and making sure we're doing the right things. Yeah,
the componentry. So that's one good one in terms of obstacles. Because I think I'm trying to I ask this because I'm coming at it from a position of like, I want to get into it myself. So I'm just trying to ask questions that I think other people will kind of value. So in my head, that's one, is like, if I'm working at a practice and my principal doesn't do it. So when you said motors and all that, is that something that you bought yourself and brought to the practice, or you like worked out with the practice owner to acquire that?
Yeah, look, it's going to be up to the negotiation with you and the practice owner. If the practice owner is never planning to do implants, it doesn't really make sense for them to want to buy one, in which case that's fine. You can offer to buy one yourself and negotiate that within a contract somehow. Or it's just one of those things where it seems initially, it's a few grand to buy it, but something that you're going to keep with you and you're always going to use it. And even if you have your own practice, like I do now, it never hurts to have an extra set of extra motor set, But I know at the time it's really daunting to make that initial outlay, like anything, especially when you're paying for like a big CPD course or modular course. But the ROI on that, it's a no-brainer.
Yeah, it's definitely.
You can't really do this work without it, Yeah. And I think another obstacle as well that I see with a lot of my colleagues starting out with implant dentistry is, I guess, the concern that you don't have the patient base to do it.
Yeah.
But just like anything, I think if you train yourself for the skills and you're equipped with that skill and that confidence that you're able to help out this patient with tooth replacement options, that really shines through when you're trying to communicate with the patient as well. And, how many times does a GP take out a tooth and a patient is missing a tooth, and literally the next step is tooth replacement options to discuss.
Yeah.
And so it naturally will have the snowball effect. But initially it is quite daunting because you're worried, I'm going to spend all this CPD and time and equipment and buying all this. Am I ever going to do a case? I think naturally it will come. You have to, again, be working in an environment that's supportive of it. But part of it is you have to drive yourself to have that confidence and, just take the plunge, really.
Yeah, that's a huge one, because a lot of us will do courses, like for example, and funny, like I did the Invisalign courses and stuff. And then I got back and I was like, I just didn't really have the drive to do cases like that. Like I didn't enjoy it particularly enough to want to do it. So it happens to a lot of people where you take a course, you spend the money, and then you come back and you don't implement it. And then a month passes and it's gone. Like you've kind of lost the motivation or the knowledge base that you kind of acquired. So I think it's a huge thing, especially if you're going to parlay like that amount of money to do the modular courses or to get your mortars and stuff like you mentioned. Really, you need to kind of have a plan, or even have maybe patients banked up ready to go. So then once you've done it, then you can just kind of roll it through and actually start placing a few. I'm curious, do you remember your first implant placement?
You never remember your first, do you? I mean, vaguely I remember. I remember. It wasn't a disaster. It wasn't a disaster. Obviously, otherwise I would never forget.
Yeah.
But it was like a gradual process for me. So it's all a blur now after you've done a few. Yeah.
What's some of the if you can go back and give yourself advice starting out, what would you have sort of changed up or done differently within implant dentistry, not just career wise, but
it's easy to say in retrospect, but obviously for the first 3 years, I wouldn't have done any ortho CPD and done more implant. But sometimes, that's just the path of life, how it goes. But definitely in the context of, I guess, practice ownership as well, once you become a practice owner, it does become that much harder to be able to do these big comprehensive courses, time away from the practice, opportunity costs as well. Yeah. So, I've always been a CPD junkie and a dental nerd, but I felt like maybe during my associate years, I could have done a bit more. Mm-hmm. But other than that, I've been really grateful for my journey. I know that it's not particularly typical as well. So I guess I'm just trying to extrapolate which aspects are applicable, for a new grad who may be in a position where they want to do more implants but doesn't have as much support. But you'll be surprised, as I said, not only other clinicians, specialists, implant reps. I'm still in my experience with MIS as well. They're more than happy to assist and help at any stage to make it, to make it more attainable.
More attainable as possible. Yeah, I think that's the thing. Just gotta get over the hump and actually start doing it, and then the momentum builds. You get some enjoyment out of it. Is there? Because obviously talking about successes and things is easy, but how did you, because the confidence aspect of surgery or even any advanced procedure like endo and stuff, because I remember early on, especially the first couple of years, you do a endo case and it goes really well, or you do 2-3 in a row that goes really well, and you're your confidence level in endo rises and you're okay, I can kind of take it on, until you kind of ledge one or you get stuck, and then you kind of go over the whole learning curve again in a way. How did you deal with those setbacks early on, in the first, a few cases, if there's any complications or something that went kind of not as planned, as it happens. How did you overcome that, from the confidence standpoint to keep going with it?
Yeah, look, that's a really good question. And I'm the type of clinician where, I always want to give it my all for the patient. And when something goes wrong, as it invariably does, when you're doing dentistry and dealing with a human body, I'm pretty hard on myself as well, just trying to think back what could be changed and different. And not only just with implant dentistry, with any dentistry. So I think one of the earliest things that I realized was that, again, sometimes you can do a technically perfect job in the mouth, and the results, you're only one factor of that as well. There's a whole patient factors, what they're doing at home, what they're doing during the healing period, how their body's response is to the treatment that you can't control. So I worry about things I can control, and the things that I can't, it's part of the informed consent. I just have a really upfront discussion with the patient. And I guess when you have that confidence in yourself to be able to tell that to the patient, it's less pressure on you. And you kind of, the weight is lifted off your shoulders a little bit, and you just focus on what you can do as best as you can, and just realize that, stuff happens sometimes. Sorry, I forgot the question.
No, it's good. We're on the right track. It was more so, how to deal with setbacks in terms of like within your implant growth in the early phases. How did you kind of overcome those to keep going or to start taking on even more like advanced cases, multi-units or and things?
Yeah, sure. So a big part is, again, I'm quite conservative in terms of the leaps and bounds I'm willing to do for treatment. So I just wanted to make sure I was really comfortable with, level A first before trying to move to level B and subsequently and beyond. And I think by just reducing that gap, there's less stress involved.
Yeah.
And just realizing that if something goes wrong, just really analyze it and learn more. And the more you learn and talk to other colleagues, you realize, hey, you know what? Some of these most experienced implant guys there and girls, they're having the same problems as well. So it kind of makes you feel better sharing those experiences and I guess learning what you can do next time as well. I know Harry, who's been a great mentor to me, he said that, if you're having a string of failures in a row, sometimes that's just, if an implant has a 1% failure rate, you just put that 1% early out of the way. That means the next ones are going to be a clear run,
Yeah, it's a good mentality.
Having that mentality or if something does go wrong, just trying to learn as much as you can from it and rather than beating yourself up and improve for the next one.
Yeah, that's great advice. Something that I'm hoping to do sort of for the next few episodes as well, before we wrap up, is just maybe go through like a clinical case in terms of get your perspective of how you would approach it kind of start to finish roughly, just like key steps, not going like fully nitty gritty. So the hypothetical case that I've kind of presented is an implant in the 2.5 site. They've come in, the tooth is missing everything. So it's not like you're doing an extraction. So just talk me through about like your initial workup, what you look for, maybe some of the discussions that you have with the patient, and then how you sort of plan the case from there. Yeah,
sure. So you were talking about 2.5. So the tooth's been taken out?
Yeah, it's healed up and they're adequate. We're not going to get too fancy with like grafting and stuff. Just like, it's like a slam dunk case, sort of just talk me through it.
And 2.5 to me is one of the nicest sites to do your first implant case. Actually, it's just out of the smile line, but upper has nice access as well.
Yeah.
Well, first of all, it starts with basics. Does a patient want an implant replacement? Go through all the different options, tooth replacement options with them, the pros and cons of each. What's a patient's wants and desires? What's their budget? And then going through obviously the medical history as well, understanding that with any surgical or dental procedure. And then from there, I think a key piece of information is a CBCT scan. That's usually where it starts. If the patient's interested in implants, we need to know the bone and the ridge dimensions. Even step before that as well, we're assuming that the rest of the dentition's sound and healthy. There's no underlying perio or caries or anything like that. I didn't know I was undergoing an exam today. I mean, no, it's good. It's good. I guess, we're in lockdown at the moment, so we can't do dentistry. So the next thing is just talk about
it. Keep you sharp.
And then, the CT scan would be cross-referenced with an intraoral scan of the mouth, which is my regular protocol. Mm-hmm. And then from there, the reason being is, I could talk for hours with this as well, but not only is the implant position important, but where does it relate to where the final crown needs to be as well, in terms of the depth, in terms of angulations in all the axes as well. So kind of work from a crown down basis. We do a virtual wax up of what the 2.5 should look like in terms of the cusps, in terms of the gingival margins, and then work backwards from there to plan where the implant needs to be. Mm-hmm. And then we're looking for the anatomical limits in that area, maxillary sinus, adjacent teeth, ridge width, whether or not bone augmentation needs to be done or not. But assuming it's a straightforward case, for a case like this, I still do fully guided as well with the M guide. Mm-hmm. So we'll send that to the planning center, but we'll plan exactly where we need the implant to go, get the surgical guide made, and basically book the patient in for surgery.
Yeah. So how long what's the turnaround time to get the guides and things kind of sorted out?
Couple of weeks, to get the planning approved and also the surgical guide printed and for them to send back components as well. And the beauty of I guess the way that we work is because the implant position, I guess it's placed where exactly you want it and need it to be. There shouldn't be any surprises if all the surgical steps are carried well. because you know exactly which implant needs to be there. You know, because you know the depth, you know which healing abutment size to order. And when it comes down to the final restorative, there's going to be no surprises because it's going to be screw access because that's how you planned it. You know, it's not going to, you're going to realize when you put your impression coping in that the implant's coming out buckle, and then you have to worry about angle correction, all that. It's kind of, measure twice, cut once, and everything just flows on from there.
Yeah, no, it's amazing. And I'm excited to kind of get into that in more detail, like in the subsequent sort of interviews. But I think the fact that you can take the variability out of the surgery so much with guided and like the imaging and stuff that you guys do, especially with like the prosthetically driven, like you mentioned, like the crown down way of doing it. It seems like it's just, quite smooth in terms of how things will kind of proceed if you've planned it kind of really well. So I think that's a great way of doing it. How, in terms of like start to finish, in terms of communicating with the patient, if that patient with the 2.5 comes in, when will you can you promise them, okay, the tooth will be in there, the restoration will be there, and you'll be functional? Like, what do you kind of communicate? How do you communicate that piece of it?
Yeah, I like to leave my implants for a good 12 weeks. Mm-hmm. So I tell for osseointegration. Yeah. So I tell the patients that that's the minimum amount of time it takes for the implant to integrate. So once I place the implant in, we're going to allow your body to integrate to it for 12 weeks, and then after that, if I'm happy with how it's healed and integrated, we can start making the tooth. And the turnaround for a tooth is a couple of weeks or so to get it made. So that's a time frame I give the patient. You see, there's no promises in there. And there's no, it's not dependent on me. The language that I use, I'm kind of saying it's your body integrating to the implant, Yeah. And so if it takes longer, they say, it's taking a bit longer, or it's about managing expectations. Because as soon as you set a date, an arbitrary date, which meant nothing to the patient before, they're going to hold it and they're going to stick to it. And if you're a day later, you've broken your promise to them. And whenever you're dealing with the human body, you just can't give promises that way.
Yeah. It's actually, I really value that you kind of highlight communication a few times throughout the interview, because I think it is a huge component in terms of just like lowering stress on yourself, setting patient expectations, and just kind of avoiding messes down the track if something doesn't go as planned. What are some of the key, do you have any other advice around communication and implant dentistry, some of the things that you've picked up on?
As I said, it's really passionate about communication. You've already had some amazing speakers on your program cover a lot of this as well, but your treatment you can only do the treatment that you can communicate with the patient, So again, I like to work quite stress-free, and I want my patients to have ownership on not only the oral health condition, but the decisions and the treatments that they do. Yeah. So I'm never, selling an implant to a patient or anything. Sometimes it's opposite. Sometimes I'm talking patients out of implants a lot, who want all their teeth removed and want implants because that's going to solve the problems. It's not. So I guess when I'm explaining different treatment options, I'm never leaning towards one option or another. But at the start, when you're asking about the patient's desires and they're saying, I don't hate my current denture because it moves and I have to take it out all the time. Mm-hmm. So, and the denture's all broken up. And so the options is either a new denture or I guess something implant supported. I just lay out all the options and the pros and cons of each. And I guess, the benefit of the implant restoration is that it's fixed and you don't have to remove it. The downside is it does require more maintenance. It costs more, and the patient makes the decision. I make the decision with them. Yeah. So they never feel like I'm trying to sell them something. If anything, I'm quite impartial to it, but I kind of highlight that if I really think an implant solution is going to help them and achieve their goals and desires, then I really highlight the benefits that's related to their pain points. So that way the patient has ownership on the decision moving forward, and I guess they value the treatment more. So that's one aspect of treatment acceptance. And then we can talk about, informed consent with failures and everything, and just not being afraid to really outline it because, patients, they're getting more sophisticated, they're getting more educated. And, if you're going to major heart surgery, you would want to know what the worst outcomes are, even though I think as young clinicians might think that I'm deterring the patient and scaring them off. It's opposite. The more I observe more experienced clinicians, the more time they spend on failures. And I guess by highlighting that, you need to, because if you don't and then something happens, it's on you because it's an excuse. And that's had an effect on me, because it just allows me to practice more comfortably and stress-free without having to worry about litigation or anything like that.
Yeah, that's a huge component for sure. I think that
Yeah.
stress of litigation is a big driving like weight on a lot of people nowadays. So I think that comes down to like
my dad in the background doing some gardening.
enjoy the nice weather. We'll get his advice as well for communication. No, but I mean that's great advice. I think that's really valuable. Just not even just for implants, but just in general. The best dentists are the best communicators for sure. Because like you said, if you have the clinical skill but you don't know how to communicate it, one, you won't get to do it enough, and two, the patient doesn't necessarily just see the occlusal anatomy that you put in. They appreciate how you communicate that to them. So I think that's really, really sound advice. I guess the last thing I'll try and just get some more information out of your advice out of you would be is just maybe like a few pieces of advice you have for like a young dentist starting implant dentistry in terms of where to do it, how to do it, cost benefits. Like, is it worth like focusing in and sacrifice? Like, say if they're already doing a bit of endo, doing a bit of ortho, and they also want to add implants, like you said, sometimes it's hard to be so scattered in terms of like everything that you do, because you'll get only like a base superficial level of understanding of how to do it like really proficient. Would you recommend like being a specialized generalist in a way?
I guess it depends on how deep you want to get into it, right? Because I mean, I've got a lot of colleagues and friends who do implant dentistry, but is, I guess, are more comfortable and limited to single or short span bridges. Because once you start looking at full arch, that opens up a whole other can of worms, and it's a whole other skill set as well. Mm-hmm. So I think with today's support and technology and workflows, certainly doing single units, which is a lot of the bread and butter, and most of the cases that you'll do anyway, is certainly attainable. And anything that requires more grafting or sinus issues, you can easily work with the surgeon in that regard. But then if you feel like, hey, I'm really enjoying this, and there's a real there's a patient need for it, that can develop further into doing more CPD and learning more to further yourself. So I think it's very attainable now to do it, to do the initial simple cases as a GP. Of course, you have to educate yourself sufficiently to understand what is simple, because again, the more you know. But these days, as I said, the barrier of entry isn't that high now, that you can just order parts as you go, and with the support. And again, I can only speak for more than who I mainly work with. They're more than happy to help and support you in that regard.
That's awesome. No, that's really good advice, Leighton. Thank you so much for the time. We've covered a lot of ground. I guess the last thing I'll leave with is, if you have anything that you think that would benefit from that I didn't ask you as pertaining to implant dentistry for the general dentist, is there any talking points or any advice or anything that I didn't ask that you think would be useful?
I think it's just hard, because there's, it can be quite confusing for a practitioner, especially starting out, because there's so many different pathways on how to go. Which implant system? Do I do a guided or non-guided? Which course do I do? Is it a short course, or do I drop 20K and do a big course? And like anything, and I had these same questions, and I was asking a lot of more experienced mentors and colleagues as well. And I'm like, what's the best course to do? And the answer is just do all of them, and that's a facetious way of just trying to say, let's just get started somewhere, because just taking that first step will open the doors for you more. And look, sometimes that first step, you might start off with a course that was crap, or an implant system that has no support, but at least you've taken one step forward, and then you can divert in the right way as well. So I guess not being afraid to take the first step, finding a company and a team or a clinician that can mentor and support you, and then self-guide yourself from there. And as I said, everyone's more than happy to, I know for myself, if you want to reach out if you have any questions about not only just clinical, but pathways, and just have a chat about it as well, then I'm more than happy to, and I'm sure many colleagues are as well. Yeah.
That's awesome. Thank you so much for coming on and sharing your experience and some advice with us. I think some really good talking points. One is like communications being so big. Two is like, not having that like decision like paralysis, but like actually taking a step to like get going, get the first one going. You'll learn from your mistakes and grow from there. And also, I think the biggest theme early on that I mentioned was just the fact that you're like proactive in the early days and making the most out of your time and opportunities to try and reach out to mentors and learn. And
especially during these times, lockdown with everything as well.
Yes, for sure.
It's a gift of time.
Yeah.
Make the most of it because, and hopefully, but in the future, we're really going to be able to pause our lives like this and do what we want to do. Hopefully, not too much, right?
Yeah, definitely a unique opportunity. Thanks, Lara. I really appreciate it.
My pleasure. Thank you.
Thank you for tuning in for another episode of the Noobie Dentist podcast. Please be sure to subscribe and head over to iTunes and give the show a 5-star rating. For all show notes and to access all previous episodes, head over to www.noobiedentist.com. Have a great day.